Top 20 NHS Values Interview Questions and Answers. Are you preparing for an NHS interview? Mastering the NHS values is key to standing out. In this video, we'll walk you through the top 20 NHS values interview questions and answers that recruiters expect you to know. From demonstrating compassion to ensuring equality, these examples will help you align your responses with the NHS Constitution. Whether you're applying as a healthcare assistant, nurse, or admin staff, these insights will boost your confidence and performance. Let's dive into the questions that can shape your NHS career. Watch till the end for a full preparation boost. 1. What do the NHS values mean to you personally? To me, the NHS values are the foundation of delivering person-centered care with integrity and respect. They guide how I treat patients, families, and colleagues, ensuring I always act with compassion, fairness, and professionalism. These values remind me to put patients first, value everyone's contributions, and continuously strive for improvement. Personally, they align with my belief that healthcare is not just about treatment. It's about kindness, dignity, and teamwork. I see the NHS values as a moral compass, shaping my conduct and reinforcing my commitment to equitable, high-quality care for every individual, regardless of background or circumstance. 2. How do you demonstrate compassion in your daily work? I demonstrate compassion by actively listening to patients, acknowledging their feelings, and offering reassurance through kind words and attentive care. I take the time to understand their emotional and physical needs, ensuring they feel heard and respected. Whether it's holding a hand during a difficult moment or explaining procedures in simple language, I aim to provide comfort and understanding. I always treat patients as individuals, not just cases, and strive to make their experience less stressful. Even during busy shifts, I prioritize empathy, recognizing its power to make patients feel safe, valued, and supported throughout their care journey. 3. Give an example of when you worked effectively in a team to help a patient. While working in a hospital ward, a patient with multiple conditions needed coordinated care. I collaborated with nurses, physiotherapists, and a dietitian to create a holistic care plan. We held regular briefings to share updates and monitor progress. I ensured timely communication of vital signs and changes in behavior, which helped adjust the treatment plan promptly. Together, we improved the patient's mobility and nutrition, leading to a smoother recovery and discharge. This experience showed how teamwork, respect, and shared goals directly benefit patient outcomes. Effective collaboration ensures no aspect of care is overlooked, reflecting NHS values in action. 4. How do you show respect and dignity to patients and colleagues? I treat every individual patient or colleague with kindness, equality, and regard for their privacy and preferences. I always knock before entering a room, explain procedures, and seek consent to make patients feel comfortable and in control. With colleagues, I listen, acknowledge their input, and foster a supportive work environment. I avoid judgment, maintain confidentiality, and value diverse perspectives. Respect and dignity are shown in every interaction, through tone, patience, and behavior. Upholding these principles strengthens trust, promotes inclusion, and ensures everyone feels safe and valued in the healthcare setting, which is essential to the ethos of the NHS. 5. Describe a time you went the extra mile to improve someone's care. A patient was feeling isolated and anxious due to limited family visits. After completing my duties, I spent extra time chatting with them daily, learning about their hobbies and life stories. I even coordinated with the ward to arrange a video call with their family. Their mood noticeably improved, and they became more engaged in their recovery. This small act significantly enhanced their emotional well-being. Going the extra mile isn't about grand gestures. It's about being present, attentive, and caring. It reflects a deep commitment to compassion and person-centered care, values I hold closely in my NHS role. 6. What does everyone counts mean to you in a healthcare setting? Everyone counts means recognizing that every patient, staff member, and volunteer has equal value and deserves respect, fairness, and quality care. It's about ensuring no one is overlooked, regardless of background, ability, or circumstances. In practice, this means listening to all voices, being inclusive, and treating patients as individuals with unique needs. I ensure I advocate for those who may struggle to speak up, like the elderly or those with language barriers. To me, this value reinforces the importance of equity, dignity, and inclusivity, ensuring that care and respect are universal, not selective, in the NHS. 7. How do you maintain high standards in the quality of your work? I maintain high standards by staying updated with best practices, following clinical guidelines, and adhering to safety protocols. I double-check tasks, ask for feedback, and learn from both successes and mistakes. I take pride in accuracy, whether it's recording patient information or administering care. I also reflect regularly on my performance and seek training to enhance my skills. Quality care isn't just about procedures, it's about attitude, consistency, and accountability. By taking ownership of my role and continuously aiming to improve, I contribute to a safe, efficient, and patient-focused environment aligned with NHS standards of excellence. 8. Tell me about a time you advocated for a patient's needs. During a shift, I noticed a patient's medication had been delayed due to a miscommunication. Knowing the medication was time-sensitive, I quickly alerted the nurse in charge, contacted the pharmacy, and ensured the patient received it without further delay. I explained the situation to the patient and reassured them. This proactive approach prevented discomfort and potential complications. Advocacy is about speaking up and acting when patients can't. It means protecting their rights, safety, and comfort. This experience reinforced my belief that patient care isn't passive. It's an active commitment to fairness, transparency, and timely intervention. 9. How do you handle cultural differences or diversity among patients? I approach cultural differences with openness, respect, and curiosity. I ask patients about their preferences, beliefs, or needs related to care and adapt accordingly, such as food restrictions, modesty concerns, or spiritual practices. I avoid assumptions and listen carefully, using interpreters if needed for clear communication. I also educate myself on different cultural practices to provide inclusive care. Recognizing and valuing diversity ensures patients feel understood and respected. Embracing cultural sensitivity not only aligns with NHS values but also enhances trust, comfort, and quality of care for all individuals, regardless of their background or beliefs. 10. Describe a situation where you supported a colleague during a difficult time. A colleague was struggling with personal stress while managing a heavy workload. I noticed they seemed overwhelmed, so I offered to help with their non-urgent tasks and encouraged them to take a proper break. I also checked in regularly and created a supportive space to talk. Later, they thanked me for being there and said it made a real difference. Supporting colleagues is vital in healthcare, where teamwork affects patient outcomes. It reflects compassion, respect, and unity, core NHS values that foster a healthier work environment and ensure no one feels alone during challenging times. 11. How do you make sure patients are involved in decisions about their care? I ensure patients are fully informed by clearly explaining their condition, options, and treatments using simple, jargon-free language. I listen actively to their concerns and encourage them to ask questions. I respect their preferences and work collaboratively to make care decisions that reflect their values and wishes. When necessary, I involve family members or advocates to support understanding. Informed consent and patient choice are central to ethical healthcare. Empowering patients to be part of their care not only builds trust but aligns directly with NHS values of dignity, respect, and improving lives through personalized care. 12. What steps do you take to continuously improve your performance? I engage in regular self-reflection and seek feedback from colleagues and supervisors to identify areas for growth. I attend relevant training sessions, read NHS guidelines, and participate in staff development programs. I also learn from incidents or errors by reviewing what went wrong and how to prevent recurrence. Staying open to constructive criticism and adopting a mindset of lifelong learning helps me adapt to changes and provide better patient care. Continuous improvement is key to maintaining high standards and contributes to a culture of safety, excellence, and professionalism in line with NHS values. 13. Can you give an example of when you upheld confidentiality and trust? While supporting a patient, a family member asked about their condition without the patient's consent. I politely explained that I couldn't share any medical information without permission. I later informed the patient about the request and offered to arrange a joint discussion if they felt comfortable. They appreciated my discretion and trusted me more afterward. Protecting patient confidentiality is vital to building trust and maintaining professional integrity. It's a core NHS value that reinforces the patient's right to privacy, autonomy, and dignity, especially in sensitive or vulnerable situations where respect and boundaries must be clearly maintained. 14. How do you respond to mistakes or complaints in the workplace? When a mistake or complaint occurs, I remain calm, listen carefully, and avoid being defensive. I acknowledge the concern, investigate the issue, and report it according to policy. If I've made a mistake, I take responsibility and learn from it to avoid repetition. I also follow up with the patient or colleague to ensure resolution and understanding. Transparency and accountability are essential in healthcare. Addressing mistakes constructively demonstrates a commitment to quality care and continuous improvement, as well as reinforcing patient trust and upholding NHS values such as integrity, compassion, and striving for excellence. 15. Why is teamwork important in the NHS, and how do you contribute? Teamwork is essential in the NHS because patient care often requires coordination among multiple professionals. I contribute by communicating openly, being reliable, respecting roles, and offering support when others are under pressure. I actively listen, share information clearly, and collaborate to achieve shared goals. By valuing every team member's input and staying solution-focused, we ensure safer and more efficient care. Working together also reduces stress and fosters a supportive environment. Teamwork reflects NHS values of respect, inclusion, and putting patients first. When teams function well, everyone benefits, especially the patients we are there to serve. 16. How do you ensure fairness and equality in your work? I treat all individuals with the same level of care, respect, and attention, regardless of age, gender, ethnicity, or background. I recognize unconscious bias and challenge any discriminatory behavior I observe. I provide care tailored to each person's needs and ensure that those who may face barriers, such as language, disability, or social disadvantage, receive the support they need. I also engage in equality and diversity training to remain aware and inclusive. Upholding fairness ensures everyone feels safe, valued, and empowered. It reflects the NHS's principle that everyone counts and promotes equity across all aspects of care delivery. 17. Describe a time you helped improve a process for patient care. While on a ward, I noticed delays in patients receiving hygiene support due to an unclear rota. I suggested creating a clear, daily task allocation sheet with time slots and responsibilities. After discussing it with the team and receiving approval, we implemented the system. As a result, care became more organized and timely, improving patient comfort and satisfaction. This experience showed that small changes can make a big difference. Contributing to improvements reflects a commitment to quality, teamwork, and patient-centered care, key NHS values that drive positive change and enhance overall healthcare delivery. 18. What actions do you take to support NHS sustainability and efficiency? I support sustainability by minimizing waste, such as using supplies efficiently, reducing unnecessary printing, and recycling properly. I conserve energy by turning off unused equipment and lights. I also encourage digital documentation where appropriate to reduce paper use. For efficiency, I prioritize tasks, follow procedures, and communicate effectively to avoid duplication and delays. These practices save resources while maintaining care quality. I believe protecting NHS resources is part of respecting future patients and colleagues. By being mindful of the environment and operational efficiency, I help sustain a healthier NHS system for generations to come. 19. How do you remain compassionate even in stressful situations? In high-pressure situations, I remind myself that each patient is vulnerable and may be feeling scared or unwell. I take a moment to breathe, focus, and ground myself emotionally so I can respond calmly and kindly. Even when time is limited, I offer small gestures, like a smile, gentle touch, or reassuring words, to show care. Compassion is not about having extra time, but about how we treat people in every interaction. Maintaining empathy, even under stress, is a reflection of professionalism and a deep commitment to NHS values, ensuring that patients feel supported no matter the circumstances. 20. How would you promote NHS values to new team members? I promote NHS values by leading by example, treating everyone with respect, showing compassion, and upholding high standards. I encourage open communication, inclusivity, and support when onboarding new staff. I take time to explain how NHS values shape our work culture and patient care. If a new colleague faces challenges, I guide them with patience and positivity. I also share real-life examples of how values influence decisions and outcomes. Promoting NHS values helps create a strong, unified team where everyone feels accountable and inspired. It ensures continuity in the quality and integrity of care across the organization. Thanks for watching Top 20 NHS Values Interview Questions and Answers. We hope these answers help you understand how to reflect the NHS Constitution in your interview responses. Remember, demonstrating compassion, respect, and teamwork isn't just about words. It's about real-life actions and attitudes. If you found this video helpful, don't forget to like, share, and subscribe for more NHS and healthcare interview tips. Good luck with your interview. Stay confident, stay prepared, and keep living the NHS values every day.